Okay, so hello and welcome to today's SCOPE webinar titled A Profile of Wellbeing in the Yukon During the COVID-19 Pandemic. Our speakers today are Samantha Salter and Ben Horowitz. Today is our second session of the SCOPE webinar series featuring Yukon government, researchers, and collaborators. We are hosting this talk with respect and gratitude on the traditional territory of the Kwamlin First Nation and Tanquichan Council. My name is Monique Chatterton, and I am the Science Policy Advisor. I work with Sabrina Kinsella, the Acting Science Advisor with the Office of the Science Advisor for the Yukon Government Executive Council Office. So I'm very pleased to introduce our speakers for today. Samantha Salter is part of the Territorial Epidemiologist team with Health and Social Services of Yukon Government. While she originally trained as a veterinarian at the University of Guelph, Samantha's passion for understanding the complex interactions between human, animal, and environmental health led her to complete a Master of Public Health degree at the University of British Columbia. Now, working as an epidemiologist and supervisor with the Yukon Government Department of Health and Social Services, Samantha applies her knowledge in biological, sociological, and public health sciences to better understand the health and well-being of populations and to generate evidence for population health action. Ben Horowitz is the Communications Director with the Executive Council Office of Yukon Government. With his experience working across the public, private, and not-for-profit sectors, Ben has focused his career in ways that help to advance the goals of sustainable development. He is currently leading the project in partnership with the University of Waterloo's Canadian Index of Wellbeing to help ensure the Yukon makes decisions that are supported by well-being evidence and indicators. Prior to joining Yukon Government in 2015, Ben worked in the fields of renewable energy and agriculture in the Greater Vancouver area and California. So Ben is a dual US-Canadian citizen and holds a journalism degree from the University of Colorado at Boulder and a Master's of Public Administration in Sustainable Management from Presidio Graduate School in San Francisco. So without further ado, I will turn the floor over to Samantha and Ben to give their presentation. Thank you so much.
Thanks, Monique. I appreciate that introduction, and thanks everyone for joining here today for this presentation. I definitely recognize a lot of names and colleagues, of course, on the call, and yeah, look forward to following up with a lot of you after the presentation today. So I think a lot of you probably are at least partially aware of this overall well-being initiative that we've been leading through the government of Yukon. Perhaps you've completed the 2020 Community Wellbeing Survey, or maybe you participated in one of our workshops back in 2019. At that time, we were leading the work under this banner, this concept of measuring what matters and looking to create a Yukon-specific index of well-being. We haven't quite gotten there to establishing our own index, but the talk today will outline where we've gotten to in the last few years. So certainly a long-term project, and this year has seen us reach a significant milestone with the release of two separate reports that are both now available on yukon.ca. One report stems from that 2020 Community Wellbeing Survey, and the other is a more general profile of well-being for the Yukon as a whole. So I will say we do a lot of surveys within the government of Yukon. I'm sure most of you know that. Most of the surveys are linked around decision-making support or a public engagement initiative. And they're tools for public polling or to gauge public acceptability on key issues, and also to crowdsource just good ideas for supporting the development of a strategy or a policy. So the Community Wellbeing Survey that we'll talk about today, it's certainly not a classic public engagement type initiative in that it's not really linked to a near-term discrete decision or a particular outcome. So in this way, you could say it's more firmly in the realm of research, research that will then go on to inform policy development and targeted interventions thereafter. So again, within the scope of my role within the Yukon government, do a lot of survey work, do a lot of work with the Yukon Bureau of Statistics. And as part of those efforts, we have this obligation to manage response burden for surveys and overall survey fatigue. And that was a real big challenge with this almost census style survey that we ran, Samantha and I, in 2020 with the Canadian Index of Wellbeing, with the Yukon Bureau of Statistics. So pre-pandemic, a survey of this length, it was generally seen as a non-starter. Who in the public would take 30, maybe 45 minutes to complete a massive survey? But let's consider what our lives were like in that middle part of 2020. As you probably recall, bars, gyms, restaurants were either all closed or operating at reduced capacity, and the majority of the workforce had vacated the office and was at home. So if those conditions weren't right to permit a large response to this very long survey, I think it was largely recognized we'd never try anything like this again. But as we'll detail in this talk, that was certainly not the case. The overall response for the community well-being survey exceeded our expectations, and we were able to produce a first of its kind well-being data set at this most unique moment in time. So again, with this presentation today, Samantha and I, we just want to ensure that one, you're aware this data set exists, and then two, you know how to access it and how to use it for your own needs and kind of end uses. So we're going to discuss how we, as well as a number of other non-governmental organizations, are using the data right now to inform decision-making and overall pandemic recovery. So just go to the next slide here. Within the government of Yukon, our recent focus on well-being indicators really began in earnest around 2018. That's when we formed this partnership with the University of Waterloo's Canadian Index of Wellbeing team. And we set out to establish a well-being baseline in the territory. And to do this, creating a robust data set to feed into our overall commitments around evidence-informed decision-making and really overall data-driven decision-making. So at that time in 2018, government was seeking a better mechanism for promoting accountability for results and trying to answer these two fundamental questions. One, how are Yukoners really doing? And two, more importantly, how can we be doing better? So while our efforts to measure well-being really began within the halls of government, we soon, just looking at, the presentation will indeed be available after the talk, but both recorded and we can follow up and provide the slides out to folks as well. So again, we're seeking to answer these two questions. How are we doing and how can we do better? And through our consultation and engagement with others outside of government, we quickly learned that there's shared interest in producing better community level data to help inform this kind of evidence-based decision-making. So just go to the next slide here. So I think it's really important to first just start with a broad definition of well-being, recognizing that there are so many ways to characterize well-being and that there are no shortage of frameworks and models out there. I'm sure many of you are aware of a variety of different models that drive towards these similar well-being outcomes. But we, in our partnership with the Canadian Index of Wellbeing, and I'll just call them the CIW from here on out, we've chosen to adopt this particular broad definition that's oriented around these 8 domains of life. And those 8 domains are just those icons at the bottom. And for us, this CIW framing of well-being resonates powerfully. It's the presence of the highest possible quality of life in its full breadth of expression, focused on but not necessarily exclusive to the 8 domains of life: good living standards, robust health, sustainable environment, vital communities, an educated populace, balanced time use, democratic participation, and of course, leisure and culture, which is foundational to well-being. So these 8 domains, once you kind of get into those 2 reports that are on yukon.ca, you'll see that it's really how both those reports are organized and how we present the data and the findings, again, oriented around those 8 domains of life. Just go to the next slide, please. So as I said earlier this year, we reached a major milestone in this project with the release of the overall profile of well-being in the Yukon, as well as the open data set, which it has a different name. It's a summary of results, effectively. So the initial goal of this project for the government of Yukon was always to establish the comprehensive well-being baseline, and then begin this process of reissuing the survey and remeasuring and monitoring progress at about an interval of around 5 years. So to create this profile well-being report, we combined the results of that 2020 community well-being survey with other non-survey data and indicators sourced from available national reports. So this blended approach to data collection and reporting was deemed the best fit for our unique context in the North because, as I'm sure most of you know, data availability can be a real challenge for the territories. So originally, we did seek to simply apply the CIW's national indicator model. For those that are maybe familiar, it's a model that's based on 64 indicators. And when we sought out to do that for Yukon, we found that we were only able to populate 28 of the 64 indicators. So the question became how best to fill those gaps. And that's when we turned to the Community Wellbeing Survey, new data collection for the territory, recognizing the need that we weren't going to be able to fill these gaps any other way. Just go to the next slide, please. So these two separate documents, again, the profile report as well as the exploration of well-being, the summary of results report, they cater to two very different audiences. And of course, each of those audiences is incredibly important. The exploration of well-being report, let's call it the technical report or the open data set. This is really a resource for planners, for policy and program managers, and for those wanting to use the science in a far more hands-on or operational way. On the other hand, the profile report, the more general report, it's written for a more general audience, and for that reason, it's much more accessible. So the complementary nature of these two reports is very well aligned with a number of policy drivers that exist in the Yukon, but namely the 2016 Yukon Science Strategy, which is all about advancing evidence-based decision-making while also ensuring that science is accessible and understandable for the public. And I will say that seeing people and organizations outside of government get excited about this work, get excited about this data set, it's one of the most gratifying parts of the work I've experienced to date. And that's kind of always been our vision, to produce this data set and share it and really treat the data as a public good. And that's always just been foundational to this project. And what we are seeing now is a variety of community organizations, NGOs, treating the well-being data set as a point of departure for new data collection and work to enhance the data that we collected through further analysis, community interviews, stakeholder interviews, things like that. So in this way, organizations well beyond government, they're drilling down into the issues more precisely to support their work advancing key issues, mostly related to the pandemic recovery, such as mental health supports and economic resilience. So I'll just go to the next slide here, please. Just a couple of statements on how different groups, government and elsewhere are treating the data. As I mentioned, we in government have been treating this as a tool for evidence-informed decision-making, a method for promoting accountability for results. And one of the areas where there's much work to be done is embedding these indicators, embedding the data within the overall corporate strategic planning approach. I think there's been some amazing work done within government to move government towards a much clearer focus on outcomes rather than simply outputs or activities. And indicators are an important part of that overall work. Another particular example, the Yukon Status of Women's Council have had a number of meetings with them recently and just have been really impressed by the work they're doing to take this data and use it to feed into their own work, analyzing gender-specific issues related to pandemic recovery. And it's been tremendous to see. And there's been other organizations or requests flowing in that similar direction. And it's just, again, it's always been the vision and the essence of this work. Just go on to the next slide, please. I will say just at a higher level, this work that the Yukon government is doing, really well oriented with a number of other initiatives at the national and of course the international level. Perhaps some of you are familiar with the Government of Canada's 2030 Agenda for Sustainable Development and its commitment to leave no one behind. So the Yukon Community Wellbeing Survey was actually funded in part by a generous grant from the Sustainable Development Goals funding program. And the SDGs, as they're called, the Sustainable Development Goals, they overlap significantly with the Canadian Index of Wellbeing measures that you see in these two reports. And they provide a framework for us to advance progress across all these overlapping areas. So in the Yukon Profile of Wellbeing report, you'll see icons associated with each of the SDGs linked in the data tables and all the other major sections of the report. So for those of you working on SDGs, just a note that there is a mechanism there to identify that overlap. I will say also that Yukon participated in a national consultation. Just go to the next slide, please. Maybe not the next slide. Just go back for me, Sam. Yeah, just talk about that quality of life, towards a quality of life strategy for Canada. Some really interesting work happening at the national level to try to provide that national level leadership for well-being indicator development. Federal government has come out with an 82 indicator model that's roughly based on the same foundations as the Index of Wellbeing model. So you're just seeing a lot of kind of parallel movements all headed in a similar direction. And perhaps we get into that in the Q&A portion about the challenges of multiple overlapping frameworks and just those, at times, a bit of a cluttered landscape in this well-being space, but needless to say, kind of all moving in the same direction. I'll just go to that next slide now. Thanks, Sam. So yeah, just getting into some specifics from the findings and the data that we saw in the results of the Community Wellbeing Survey. So first and foremost, I will say that conducting this survey during the COVID-19 pandemic was certainly never part of the plan. In 2018, when the project was being initiated, again, the intention was always to establish a well-being baseline and then begin remeasuring progress over time. So, again, doing that in the context of the pandemic, certainly not the ideal time to be setting a baseline. But, this is the hand everyone was dealt, and we moved forward, and the results have proved incredibly valuable despite the many operational challenges that, everyone was facing in 2020. I will say, there's always going to be limitations to surveys and the usefulness of the data, but the perceptions-based or self-reported well-being that we were able to capture during the pandemic, the results are really, they're just so honest, and they give us within government as well as other organizations the kind of point in time information that we all need to make informed decisions. So here on this particular chart on the slide, feelings of social isolation, this is housed within the community vitality domain, one of the 8 domains of life. And again, these findings, they have to be framed within the context of the pandemic and the particular concerns that were present in the first year of the overall COVID response. And at that time, public health measures, of course, were at their most stringent. And what we were able to confirm in the data is that people living with a disability or a chronic illness are particularly vulnerable to social isolation, certainly amplified during the pandemic. What you see here in the data is that almost 20% more people are living with a disability and 10% more people living with a chronic illness. They feel this sense of social isolation compared to the rest of Yukon's population. And as the report states, living under these circumstances significantly limits people's ability to fully participate in their communities, thereby further exacerbating their feelings of isolation. So it's with that kind of evidence and insight that we can strengthen our resolve to continue better supporting those in our territory living with disabilities and chronic illness. To that end, one example, we're now on the road to developing a type 1 diabetes support strategy, in addition to many other implementation commitments from the Putting People First comprehensive healthcare action plan. So again, the way we're using this data, it's a tool for validating and affirming the need to be investing in various elements of strategies, such as putting people first. Go on to the next slide here, please. So another key finding here relates to a similar theme, this perception of quality and perceived accessibility of healthcare services in general, and then mental health services in particular. So very strong alignment with the putting people first strategy. These perceptions-based indicators, they serve as a great starting place as, again, we take action informed by evidence to improve the measures and enhance healthcare delivery over time in the territory. Besides the healthcare area reflected within the data, we were pleased to see a number of other positives reflected in the community well-being survey results. And just go to the next slide, please, Sam. So just some high-level results. The survey confirmed and it made clear that Yukoners feel highly engaged in their communities. They feel connected and proud of where they live. They can depend on their neighbors and community members to help in times of need. And they have confidence in our overall institutions, such as police and healthcare services, compared to the rest of Canada. So I could share many other highlights from the report, but once again, just really encourage people to dive into the findings, dive into these two reports, and come back with questions or concerns or really any feedback you have for myself and Sam. The overall project, it's been very challenging multi-year effort, but it's also been an incredibly enriching experience for us. I really do think it takes some courage to look at the vulnerabilities and the weaknesses within our society with a real level of openness and honesty, and then take targeted action in response to those findings. We all want to sustain momentum where we're strong, and I think most of us want to also be focusing attention on those areas where we have some gaps to close. And that, in my mind, the gap closing aspect of this work is it's the true promise and potential of a data-driven, indicators-based approach to measuring what matters. And we certainly have a long way to go with this work, but are pretty excited about this milestone this year and looking to reissue the survey in the next year or so. So look forward to question and answer components of this hour. And with that, turn it over to Samantha to discuss in more detail her involvement in the project from more the health and social services and pandemic response perspective.
Awesome. Thank you, Ben, so much for that great overview of the Wellbeing Survey. So as Ben mentioned, I was lucky enough to start working with him during the summer of 2020 at the Health Emergency Operations Center as the government of Yukon was sort of preparing for and rolling out their pandemic response. So with such rapid and large scale changes being implemented, it had become apparent to the Chief Medical Officer of Health, as well as the Department of Health and Social Services, that we would need a way to track the well-being of Yukoners beyond the immediate or more direct impacts of COVID-19. See if my little images work. Perfect. So several institutions started to track both the impacts of COVID-19 and the impacts of public health measures quite quickly. So here I've highlighted a headline from the Canadian Institute for Health Information from their website, where they examined the impacts of the pandemic public health measures on harms caused by substance use, self-harm, and unintentional falls. And thankfully, we were closely connected with the BC Centre for Disease Control, or BC CDC. And through them, we were connected to their Unintended Consequences Working Group, which eventually was renamed to the Societal Consequences Working Group. So a surveillance framework was developed, informed by a literature scan completed by the BC Office of the Provincial Health Officer. And to take an equity lens, there was an intention within this framework to stratify indicators by sex and gender, age, geography, ethnicity, education, and income where possible. This framework also aligned closely with the Yukon Wellbeing Survey framework. And so rather than embark on our own survey development and launch, the Yukon Wellbeing Survey is an example of where we were able to take a whole of government approach and seize the opportunity to collaborate with the Executive Council Office to gather data that was relevant to multiple purposes. So, Ben was explaining all of the work that his team had done leading up to this, and it was a little bit of good timing in terms of we were seeking a way to sort of rapidly collect some information, and ECO was seeking a way to pick up a rollout of their survey. So it was really fortuitous timing for us in a way. So given the speed at which we needed to roll this out, we worked really closely with both the University of Waterloo and biostatisticians and epidemiologists at the BC Centre for Disease Control. And this was to try to make our survey questions comparable to others that were happening in Canada, and to use questions that had already been validated in other surveys. So we did manage to narrow our questions down to these main areas, and this made up the first section of the survey, or section A. So you can see some of the major sections or themes were perceptions of the response, the level of concern for different potential consequences of the public health measures, where people were getting their information on the pandemic, impacts to physical, mental, financial, social, and environmental health, and access to services. The results gave us really valuable insights into perceptions and self-reported impacts of public health measures, and helped to give a more balanced understanding of the impacts to overall well-being of Yukoners during the first year of the pandemic. So for that first section of the survey, the results were prepared within the following themes, which closely aligned with our original unintended consequences framework, which was informed by British Columbia's work. So you can see some of the major themes by which we conducted our analysis, looking at education and employment, factors related to resiliency, the environment, substance use, overall pandemic experience, financial impact, health service utilization and access, and mental health. So the technical report available online, which Ben spoke about earlier, presents all of the survey questions, including this first section, for results for Yukon overall, as well as by region. And there's also the ability to combine the pandemic impact questions with demographic variables that were collected as part of the survey, such as age, community, sex, gender, education, and income. We have received some requests to build custom tables with this data to better understand the impacts of the pandemic. So while it was a point in time, it's still considered a useful learning exercise by many organizations, including ours, to do that look back. And while we only have this point in time data, future iterations will continue to help us understand and inform our recovery from the pandemic. So lots of synergies happening with the Wellbeing Survey. There are a lot of results which you can further explore online, so I won't go into too much detail. I know Ben already touched on some results from the other sections of the report, but I did want to review a few highlights. So this slide shows some of the indicators we categorized as pandemic experience. And so one example of how this was used was, understanding if people were able to work from home and or stay home if they were ill or their child was ill, did inform income and sick relief programs during the pandemic. Just to review some additional results that aren't shown on this slide, but some Yukoners did report positive impacts to factors that affect resiliency, such as getting more sleep and rest, keeping in shape more, nurturing their spiritual or creative side more, and eating healthy more. However, we did see in the survey that a larger proportion reported the opposite effect. So getting less sleep, keeping in shape less, nurturing their spiritual or creative side less, and eating healthy less. Further examples of results, more survey respondents reported increasing use of substances than those who reported decreasing the use. And this pattern was consistent with British Columbia Northern Health Authority, as well as BC overall. And alcohol was the most common substance for respondents to report increasing use. The majority of Yukoners felt the response to the pandemic was appropriate, as you can see on this slide, at the time of the survey. But these results did have some variation among different groups. So for example, males were more likely than females to report the response as being too extreme. And younger age groups were more likely than older age groups to report the response as being too extreme as well. So this slide highlights some indicator results around healthcare access, and specifically these were responses from people who said they had avoided care or experienced difficulty accessing services during the pandemic. So about 34% of survey respondents reported difficulty accessing healthcare services, and almost 40% reported avoiding healthcare services since the start of the pandemic. So among those folks, the most commonly cited reasons, as you can see here on the slide, were that they were told not to attend a provider's office or facility, they didn't consider their need to be an emergency situation, and or they experienced changes, cancellations, or other restrictions on access. And this was important to understand as well, because you could see lower down was being worried about being able to complete self-isolation if traveling for care. So that was an important consideration to make around public health measures. Again, results not shown here, but just wanted to highlight some further. So from the financial theme, about 24% of survey respondents reported that their financial situation would worsen if the pandemic response did not change. And interestingly, this was about half of how many reported the same in BC Northern Health Authority and BC overall, which both had results of about 43% of their respondents reporting that their financial situation would worsen. And finally, some highlights for mental health. The most commonly cited negative impact on mental health among survey respondents, so this was almost half of survey respondents said that they had negative impacts due to someone else's mental health issues. And these negative impacts were generally more likely to be reported among females than males and among younger age groups. And we found this was also consistent with survey results from across Canada. So that's a very brief highlight of the unintended consequences section and how that was used. This does conclude our presentation. We'd be happy to answer any questions you have or just hear your thoughts in general. And we've left lots of time for discussion. So thanks everyone for coming, and I'll turn it back to Monique.
Yes, thanks Samantha and Ben for a really interesting presentation. I'm glad we have some time now for discussion, and yeah, also I can open up the floor for some questions. So again, you can raise your hand over Zoom, or you raise your hand up, or you can put your question in the chat. I did notice a question come in the chat during the presentation, so I can go ahead and read that question out. So this is a question from Bob. Bob, are you good with me reading this out? That was your intention?
Yes.
Okay, thank you. So the question is, so once upon a time, long ago and far away philosophically, the Yukon Council of Economy and Environment was looking for alternatives to the gross domestic product, GDP, model of economic and overall well-being, things like genuine progress indicators. Is this well-being work driving work on the economic lens?
Yeah, it's a great question. I saw that pop up earlier, and thanks, Bob. I will say I participated in this webinar a couple of weeks ago with this group, this national group called the Canadian Wellbeing Knowledge Network, and there were a number of both Canadian as well as international panelists. And the topic of that webinar was sharing lessons learned and approaches for moving beyond GDP. And the question posed to this whole panel, myself included, was, are we still working in that kind of overall narrative of beyond GDP, and is it an either or a both and? And I think the general consensus was it's a both and, because what you're seeing is, even in this federal model, this quality of life model, this 82 indicator framework, GDP is one of those indicators. And sure, we absolutely need measures that tell us more fundamentally how we're doing as communities, and these more in-depth measures of well-being. But I think across the board, the consensus was GDP is still a relevant measure for some things. Of course, we know in Yukon it's a bit less so. The vulnerability to shocks to our GDP is incredible, given the mining related impacts. And I think everyone would agree, like, GDP goes down and our quality of life doesn't necessarily trend along with it in the near term. So absolutely, that narrative of beyond GDP, it's a great point of departure for having this conversation, but I don't think it'll ever be an either or. And to your point about the Yukon Council on Economy and Environment, when we were doing these workshops in 2019, folks that have been around a lot longer than I have raised that same issue, and it was definitely eye-opening. Some said something to the effect of, well, we've been down this road before, and why is this different? And that awareness of that work is definitely a driver of what we're doing now. And specifically around the economic piece, I would point to the survey results in the areas of experiences of financial insecurity, because for me personally, these were pretty eye-opening. The questions in the survey range from, I could not, rate your experience on the following: I could not pay my bills on time. Well, 80% of respondents said, I, never could not pay my bills on time, not a problem. But 20% of respondents, it's either once in the past 12 months, at least once every 6 months, at least once every 3 months, or at least monthly, having trouble paying basic bills. And, you go down through some of the other survey results: I could not pay my mortgage or rent on time. I could not afford medical, dental, counseling visits, even though I needed the care. And sure, the percentage of respondents that never had these challenges is quite high, but the gap is also significant. And I think that's, again, always been the most compelling part for me about this work, is understanding where those vulnerabilities are. Like, everyone wants to celebrate the high, positive outcome on some of these survey results, but it's that other side of the coin where I think the real opportunities are. And the survey results definitely tell a more intricate story than kind of meets the eye in our day to day. So again, thanks, Bob, for the question. And I don't know if that touches on the high notes, or if we want to go further.
Yeah, and just to add to what you said, Ben, I agree. And I think, even the fact that this survey took place is an indication that we're moving away from GDP as the single measure of well-being for a population. And the fact that the Canadian Knowledge Network on Wellbeing and other networks that both Ben and I have been connected into through this work. So the National Collaborating Center on Healthy Public Policy is also now pursuing work connected to that group. And there's this increasing recognition that GDP is not a good measure for well-being. And there are lots of different ways you can go about it. Canadian Index of Wellbeing, I think the fact that they've created an index is indicative of looking at these multiple different facets and trying to pull them together. It's a recognition that well-being is complex, and GDP affects that in different ways. And so how can we look at this as a whole, but also start to break down where these improvements can be made and where our strengths are, and to really build on those strengths as well.
Thanks, that's encouraging. My sort of one caveat would be, this work seems to have been triggered in a large part due to the COVID emergency and dealing with that. And I'm a bit skeptical that as we move into this being the new normal, that initiatives like this may just fall by the wayside.
Yeah, I'll jump in there. I think, part of the story we tried to tell today is, this happenstance of joining forces between, an existing overall government initiative around measuring well-being, and then, here comes the pandemic, late 2019, early 2020, and joining forces to reduce that survey fatigue, reduce that respondent burden. But yeah, the overall well-being initiative was underway in 2018, certainly long before the pandemic drivers came into focus. And the questions I've been getting more are, will this be resilient over political lifestyles or life cycles, not necessarily the pandemic related timeline? And of course the answer is we don't know, and we would hope so, because of all the traction and movement you're seeing internationally, nationally, federal government, et cetera. We're trying to depoliticize to the degree possible this work. That's what we do in working with the Bureau of Statistics, and apolitical agency. And yeah, just to your question, Bob, I'm optimistic this will outlive the pandemic, and certainly we're not out of it yet. So remains to be seen.
I think the other positive we have is, as you mentioned earlier, Ben, the alignment of an initiative like this with putting people first. And so I'll also note, health and all policies, while it's different, it's related. That was one recommendation from the Putting People First report. And a survey like this can support that effort of implementing a health and all policies approach. It also supports the effort of a population health approach, which, taking a population health approach and increasing our use of evidence in our decision-making was a huge part of that report. So I think the optimism I have is that it's aligned with strategic priorities like that. But yeah, there's never any guarantee, and we remain hopeful, but yeah, can't guarantee anything.
Okay, thanks for that question, Bob, and thanks for your answers, Samantha and Ben. I see we have another question. Lisa had her hand up for a while, so maybe we'll go with Lisa. Would you like to ask your question?
Yeah, thanks for the presentation. It's really interesting to see how far along this project has come. I was involved in or participated in some of your early sessions back in 2019 when you were engaging with the public on this. One question I'd like to ask is what your approach is to facilitating policy change and action. Like, is there a working group that makes recommendations, or do you make presentations to different groups and organizations?
Yeah, it's a great question, Lisa, and I think it's under kind of the banner of how to operationalize this, how to really move it forward in a coherent way within governments. And it's definitely early days on that. And I think the strategic planning process is one area of opportunity, potentially, overall government decision-making framework another. Just how cabinet makes decisions is, reflective of various priorities, whether it's climate change or gender inclusivity. Framing decisions in through those lenses are another opportunity. But as far as a working group or kind of a localized version of this national Canadian Wellbeing Knowledge Network, I think those are discussions that are definitely on the table, and sounds like you've got some good ideas there, and would love to talk more.
Okay, thanks for your answer. Yeah, I'd be happy to chat more and follow up. Thank you.
Yeah, thanks for your question, Lisa. So we have another question. Stephanie, do you still have a question?
I think it's quite similar as discussing about or a question about whether there's been discussions with the federal policy, the federal framework coming out last year in integrating this more formally into the policy development and sort of assessment life cycle. So it's pretty comparable, I think. It's good to know that the discussions on how to use it are ongoing, and just very curious about where that lives, both in the, or if it lives, or, where it may live, or if there's discussions ongoing, in the sort of like acute policy development process of like individual policy, like we hope gender analysis gets integrated, and sort of like, as you mentioned, in the broader sort of strategic planning sense. So I think your answer to the last question might suggest that those discussions are ongoing, but if there's anything additional to add, I guess, on those points.
Yeah, thanks, Stephanie. So it's the, what is it? Treasury Board of Canada is the actual group within the federal government leading that quality of life framework, the 82 indicator model. And after participating in this webinar with them a week or so ago, they reached out again and are interested in talking with Yukon specifically, just because they continue to look to us as, potential guides for how to roll out the framework they're developing locally, and would love to involve you and Department of Finance in those conversations. I think, again, it's a lot been 2018 onwards, and I think a lot of folks within government may have lost the plot with just some of the pandemic disruptions and all the rest, but we're gaining traction again, and alignment with that federal work is definitely picking up steam, so we should stay in touch.
Okay, thanks for your question, Stephanie. I see we have another question from Michelle. Michelle, would you like to ask your question?
Hi, Sam, Ben, really thanks for the talk. It was great to see some of this data, and I'm excited to take a look at it later and see what happens. And I also appreciate the questions from Lisa and Stephanie. I think it's really important that this data is actually being used to inform policies moving forward. But I want to put a different hat on right now and put my researcher hat on. I just have a very curious question. I found it very interesting that we've always sort of been concerned in the past about our older population in relation to isolation. And actually now what you've seen is, doing this wellbeing survey during COVID, is that you're actually seeing that younger populations are reporting being more isolated. And then Sam, you also mentioned in terms of mental health, that younger populations were experiencing more significant mental health issues compared to older populations. And I'm wondering if you have any additional hypotheses about this, and then how do you reconcile that moving forward if you are looking at, developing policies around this, and, where do you sort of break it up between, okay, we're going to put this down to COVID versus, okay, this is actually our new normal moving forward, and COVID has caused this long-term disruption?
Yeah, that's a really great question. And I think one that a lot of people are grappling with. And certainly I don't know that we can necessarily extrapolate it from our own data, but a reasonable hypothesis based on other studies that occurred during the pandemic. A lot of the impacts on younger age groups and youth were related to things like school closures, disruption of recreational activities. So it was a very sudden discontinuation of these activities that would normally bring children and youth together. And so the interesting question to me will be, have we changed that? And I know there were a lot of studies really looking at the impacts of school closures, and that's I think that's still up for debate. It's a very contentious sort of question of, do the harms of closing outweigh the potential harms of opening with the spread of respiratory illness? So I don't know that there's a right answer, but certainly I think the impacts will be measured in future years down the road, unfortunately. And so a bit of that is where we've yet to see. Whereas with our older populations, you know, it really, really highlighted where we saw a lot of the issues highlighted was where there weren't stringent public health measures or adequate conditions in long-term care facilities, for example. That was really highlighted by the pandemic as well. Whereas, you know, in some cases, the pandemic public health measures actually increased sort of the creativity in reducing isolation in places like long-term care facilities. And so there was a very concerted effort. And then in terms of perceptions of impacts, I think the other sort of hypothesis is that older populations, we know that they are the most susceptible to, they're one of the groups is most susceptible to negative impacts of the virus. So to them, the risk benefit analysis is, I would rather have these activities stop than, you know, face the risk of a really severe outcome due to infection with the virus. And so I think there's some element of that coming out in the survey results, whereas younger age groups, you know, there's not the same, it's not a non-zero risk for infection with COVID, but it's a much, much lower risk. And so the impact of having your social and recreational and educational activities discontinued, I think is going to weigh a lot heavier than facing the risk of infection with the virus itself. And so this is where some of this data has been really insightful, and I don't have all of the right answers. A lot of these decisions, you know, you saw they were different among different provinces and territories and countries, and they're very value-laden decisions that the data informs them, but it's not the only thing that determines them. And so I think these are all just things that, you know, as epidemiologists, we can present the data, but then the policymakers have to sort of make sense of what to do with those results. And so, yeah, I think it'll be really interesting in our recovery efforts to do further data collection points to see how we're doing with children and youth, because we know that those impacts are going to be lasting into the future. And what have we done for, you know, some very significant issues that were highlighted by the pandemic in some areas of the country, such as, you know, long-term care facilities and sort of the well-being associated with all of the things that go with that. So I don't know if that kind of answers your question, but.
Okay, thank you for that question, Michelle. Thanks for your answer. We just have a couple more minutes left. Does anyone have another quick question they wanted to ask? Just take a look. Okay, I think that might be it. Just pointing out that Ben.
I'll ask one quickly if there's 2 minutes.
Oh, yeah, two minutes. You got it.
Of the survey, I remember doing the survey. What portion of the survey will be recurring, and what portion of the survey will be like a one-time only COVID? Like, is there part that will just sort of drop out, and approximately how big is that part? And do we feel there'll be any losses with that?
Yeah, it's a great question, Stephanie, and you're absolutely right that the joining of the work with the Index of Wellbeing with Sam's work and the Chief Medical Officer's survey at the time saw the addition of that whole front end pandemic unintended consequences section in the actual questionnaire. It was section A. So you got through section A, and then after that, you moved on to the more standard form community well-being survey. And no decisions have been made on, you know, the exact design of future questionnaires, but just for that comparability with other jurisdictions, other regions running that survey, it's nice to keep it a bit more consistent. And I know Sam and her team definitely have ambitions to be resurveying. We do too. So how to join up or not in the future is an open question. But yeah, just for awareness, it was that whole section A of the original questionnaire that was kind of the add-on, the partnership with the CMOH at the time.
Yeah, and so I think certainly there are going to be some questions in that section that we need to revisit and say, does it make sense to ask this again? You know, like, obviously where are you getting sources of information? You know, the questions around what's still relevant and what do we really want to focus on? And I think that was some of the feedback we heard, that it was very, very long, and we probably got the great response we did because of some of the factors Ben spoke about, you know, people having time, but also like a really high engagement level with what was happening with the pandemic at the time. I doubt we'll be so lucky a second time. So certainly we'll have that will have to be part of the discussion for sure.
Okay, thank you for that last question. We're at time now, just coming on 1 o'clock. So thank you so much, everyone, for your participation today and for that great presentation, Ben and Samantha, and a good discussion. So we'll be making this recording available through our Scope Facebook page and Scope e-newsletter. So I will feel free to contact me if you want to be part of that newsletter. I'm just going to type my email into the chat here, and in case you need that. So feel free to contact me if you want that. We have a few more sessions coming up in the weeks to come. So stay tuned for those. And thanks again, everyone. Okay, have a great day.